My name is Pete Giardina. I had a couple of strokes about 5 years ago. My first stroke was a clotting stroke, and then the second stroke was a brain bleed. And the effect of the two strokes left my left arm and leg useless. So I had joined a stroke survivor group, and at one of the meetings, they had a presenter that gave us a presentation about this JOGO device. And I was quite fascinated by the presentation. And the thing that really stirred my interest was the fact that you could use this device. It didn't matter what kind of stroke you had or how long ago you had it. Now, there were other devices that were out there that I had been looking into, but they were all invasive. They required surgery. And one of the devices I tried also proved to be very interesting and struck my interest. But when I finally got the insurance company to approve it, it was very cumbersome and very difficult to put on. Even the occupational therapist that was sent to the home to help us learn how to use this other type of device had difficulty putting this thing on me. And every time we tried it, there was always something that didn't go right with the laptop or the device itself. So it became quite frustrating. So when I first heard about JOGO, I was really very excited about it. And I started using it since about the beginning of April. And I also have recommended it to a number of people, other people that belong to other stroke survivor groups, and they found it a positive experience as well. So I guess overall, I have maybe 4 or 5 people that have also joined the JOGO family, and they're all making progress as well as I did. Now, using the JOGO device was very easy. It was very easy for my caregiver and wife, Regina, to put the device on me and connect the electrodes. It's very, very simple to use. There was it didn't take a brain scientist to know how to use it. And I found it very beneficial to look at the blips on the iPad that shows you when your muscles are being triggered. And seeing that got me the feeling in my arm and hand of when my muscles are triggered, and I was able to replicate it later on, just thinking how it felt, and I was able to do it without actually looking at the iPad device. And without even realizing it, I was moving my arm and my hand. And a number of instances, I also visualized what it would feel like to move my arm and my hand, and I was able to do so. So overall, I would recommend the JOGO device to anybody who's had a stroke and has had difficulty with either their arm or hand, and it did improve slightly over the course of the couple of weeks or months that I've been using it. I find that I have a lot more flexibility in my arm, my wrist. I still would like to use it and continue using it further so that I get some more functionality and movement in my fingers. My initial goal in using this device was to get my fingers and my hand to function like I used to prior to the stroke, so that I can continue to play the guitar, the banjo, and the piano. I haven't gotten my full flexibility in my fingers or hand yet, but I have seen an improvement with the JOGO device and being able to grasp objects and being able to move my hand back and forth. And it's promising. And hopefully with a few more weeks of practice and doing my homework assignments, I'll be able to improve even more. I don't know if you can see the picture. I'm trying to hold up my hand. And now I'm not pulling it with my right, I'm just holding it up in the air. And now I can move my left arm back and forth. And I'm doing that with just my left arm. I'm not pulling it with my right. And I'm able to lift my hand up and extend it a lot more now after using the JOGO device than I was able to after I initially had the stroke. And again, the advantage of the JOGO is that it's very, very easy to use. It's easy for the caregiver who might be helping putting the device on you with the electrodes on you. And setting up the iPad device is very easy. And the occupational therapist I had, Chanel Patel, was very, very nice, very pleasant, very easy to work with. She was always very patient with me, would explain everything and tell me exactly what to do, when to do it. And overall, it's a very positive experience. I would highly recommend anybody who's had a stroke that has lost the use of their limb, hand, to try this device. Again, it's a passive use. It's not like some other devices where you have to have an operation and surgery. I have a friend who has another device that was implanted in her, and she's gained some movement in her hand and arm usage. But again, it's major surgery. They put you under anesthesia. And for people elderly like me, it's quite an ordeal to have surgery. So the JOGO is a godsend in that it's passive. You don't have to have any surgery. So once again, I highly recommend it. And I went to Dr. Aben, and he was quite enthusiastic about the device. And my next step is after I do a little bit more of improvement with my arm and my leg and my hand, I'm going to ask Dr. Aben whether or not he thinks it might be worth my while to try it on my leg. That's another advantage of the JOGO. You can use it on any affected muscle group. You're not limited to just one area. So I can use it on my hand, arm, and leg. So my next question to Dr. Aben next time I see him is, what is his thoughts about using it on my leg? Oh, one piece of advice before I forget. I initially was receiving Botox treatments, and I would recommend anybody who's going to consider using the JOGO to postpone using the Botox treatments because it's counterproductive to using the JOGO. The JOGO helps strengthen your muscles. Botox weakens your muscles. True, the Botox gets rid of the spasticity, which it helped in my case, because initially after the stroke, I had severe spasticity in my hand. My hand was always clenched like a fist. But then after a while, I realized I have to stop using the Botox because I want to gain strength in my hand and my arm. And the JOGO helped me do that.